Welcome, everybody. I am Dr. Jen, and this is Eat Your Damn Food. And we have Hannah Saenz joining us again, nutritionist for the FAB program. So, Hannah, thank you so much for being here.
No, thank you for having me.
So, today we're going to talk about working with loved ones who are really concerned about somebody in their life with that they suspect has an eating disorder.
Mhm.
And Hannah, you and I spent a lot of time on Saturday together. And one of the things we did on Saturday is we worked with families in the FAB program. And families, loved ones, oftentimes have lots of questions, and one of the questions we get a lot that people start to ask us right from the beginning is like, does my loved one even have an eating disorder? Like, I think they are struggling with something with their food, right? And they don't know. And I'm wondering, you've worked with enough families over the years of like, what are some of the signs and symptoms we begin to see? And this may help our loved ones listening today of like, what are the things you start to notice, or what are the signs and symptoms to start really paying attention to?
Yeah, it's definitely something that I've heard from parents of. I feel bad that I didn't notice sooner, or I can't believe that I didn't see the signs, because we know as clinicians that there's the whole like DSM-5, like what are the criteria to diagnose them? But then sometimes things are not so black and white. So sometimes behaviors of different disorders can kind of blend together, or maybe the individual is really good at hiding some behaviors. So, is your loved one very rigid with their food or exercise? That's one of them. Are they very maybe private and defensive if you try to um, address their food or exercise behaviors, or their uh, about their weight even? Are you noticing that it looks like your loved one is plating food or packing lunch, but maybe they look like they're losing weight, or maybe they're really irritable, because sometimes parents who send their school age children to school send them with a lunch and send them with a breakfast, and then they say, oh, they're not hungry for dinner, or whatever the case may be, but then their child is losing weight or not growing properly. So then it's the question of, you're sending them with lunch, but are they eating it?
Mhm.
Right. Um, you know, there's a fine line between being even like health conscious or very into fitness and an eating disorder, right? Because there's
Mhm.
orthorexia, there's exercise addiction, things like that. So those are some things that I would look out for. Are they running to the bathroom very quickly after a meal? Are they sort of just picking at their food, taking really small bites, um, sort of drinking more water or diet beverages, chewing a lot of gum? Like we could go
Mm.
on and on and on.
Yeah, we can go on and on because sometimes it's hard to know, right? Like I say that these eating disorders can seem like an iceberg where we might only be seeing the tip of the iceberg. And you said something so important that people get really good at hiding.
Yeah.
And I remember even at the treatment center where I worked in the first part of my career, that people would get so sneaky, even at a treatment center,
Yeah.
that they were in 24/7. And sometimes when people discharge, they would say, "Hey, Dr. Jen, I want to tell you what the community was really doing." And I'm like, "Oh my gosh, like how could they get away with those things, right?" But
Yeah.
like the eating disorder survives by being really secret. So it makes it harder for parents or spouses to kind of know what's going on. And something I say to loved ones is like, trust your gut. You might not be seeing everything, but if something is starting to feel off, I would say pay attention and trust like what you're seeing. And also, if you're starting to see changes in your loved one? Like you mentioned this piece about being irritable, like oftentimes mood can change. And I'm wondering, I mean, what you said, irritability is one of those things, or changes in the eating pattern. So, like where they were, and now what you're seeing with your loved one, like there seems to be a gap between where they were and where they are, maybe in lots of different areas.
Yeah, absolutely. Yeah. I mean, we all know the feeling of being hangry, right? When you wait too long and you just want to scream at your loved one and then you eat your food and you're like, oh, I feel better now. But the reality is that that's just like a little snippet, but long-term inadequate intake or restriction does impact mood. So I tell the clients, like, maybe your baseline is anxious, but when you're restricting, that's going to increase 100-fold, you
Mhm.
know. So whatever the underlying comorbidity, right, that there is, if they have anxiety or depression, like if they're not eating, it's really gonna increase, because the brain is sort of like a train now that's supposed to be going a certain speed, and it's sort of just like barely trucking along on the tracks,
Mhm.
sort of going in slow motion. And yeah, so their mood can definitely change, their attitude can change. I mentioned defensiveness. If you say like, oh, well, why don't you just skip the gym and let's all go to the restaurant for dad's birthday? And they're like, no, I can't go, like that reactiveness. It's like,
Mhm.
whoa, I didn't really know that you were that passionate about the gym. Like, what's
Mhm.
going on here? And you might recognize it as a common relationship power struggle, especially if they're
Mhm.
a teenager, but there might be something bigger there. Um, or why
Going
don't you
on.
just go have pizza with your friends? And it's like, if there's a reaction and a defensiveness there, there's probably something bigger.
Bigger going on.
Yeah.
And Hannah, you mentioned this idea of the orthorexia,
Mhm.
and some people have heard that word and other people have not. So can you describe a little bit more what that term means, and then why it can also then get very tricky to understand, well, is this somebody quote unquote trying to be healthy, or now it's gone into that more rigid obsessiveness and it's now kind of more in disordered eating or eating disorder world?
Yeah, and it is really difficult, because unfortunately, the majority of our society sort of fits the criteria for orthorexia. It's kind of trending without people really knowing that. So it can't. This one, it's very sneaky. It can be difficult to pinpoint that fine line between health conscious and orthorexic. So some signs of orthorexia is like compulsively checking the nutrition label and ingredient list. This is a big one that a lot of people do. We hear a lot of people say, if I can't pronounce it, I won't eat it. And I'm like, well, okay.
Mhm.
If we break down the chemical compounds of every single thing, even naturally occurring things, like most of us, unless you studied chemistry, like can't pronounce it, right? And that's okay. It doesn't mean it's bad.
Mhm.
So that's a big one. Um, but the key word is compulsive.
Mhm.
So maybe you're trying to be conscious of the nutrition label. That's one thing. But if it's like, I absolutely cannot eat anything that I don't know what's in it, or there's too many ingredients and I absolutely can't eat it. The reactivity, the obsession, the defensiveness, the rigidity that's associated with this is the fine line here. So another one is cutting out an increased number of food groups. Again, something that a lot of people do. There's so many
Mhm.
people that, for not necessarily health reasons, are uh, carbohydrate free diet, dairy free, or um, sugar free, fat free. Like a lot of people jump on these trends. So
Mhm.
this is another piece that now you're probably seeing how, wait, that sounds like my friend, and that sounds like so and
Yeah,
so, and
right?
that sounds like that celebrity.
Yeah.
So
I yeah, and Hannah, I think I'm going to have you come back and we're going to just have a whole show about why eat our carbohydrates, but we're going to save that for
yeah, For sure.
for another time, right?
Yeah.
So like we're both sort of teasing out, sometimes it's hard to figure out what's, a person trying to work on their health and starting to make these decisions. And then when has it moved into this other obsessive, compulsive, like rigid world where it's affecting their lives, it's affecting their relationships, it's affecting them socially. And then the question is how do you start having a conversation if you're the loved one? Whoa, I got a tickle. You're the loved one and you're really wanting to express your concern because you mentioned a few moments ago about that defensiveness. And so sometimes people are like walking around this pink elephant because they don't want to have their loved one be reactive, or they're questioning themselves like, is this a problem? Isn't this a problem?
Mhm.
And how do you begin to have those conversations, whether it's like a younger person, a teenager, but sometimes it's an adult person, right? We've had young people in our program and we've had, up to 70 plus in FAB, right? Like eating disorders don't discriminate in terms of age. And so having these courageous conversations, it really takes something.
Yeah. Yeah, it does. And I think that the main thing would to not use like a accusatory language. So even if someone was struggling with a substance, an addiction to a substance, you wouldn't bang your hands on the table and say, "Are you an addict? Please tell me. I gotta know." Like, because that's saying, "Are you an addict? Like, are you anorexic? Do you have one of those eating disorders?" Like, that might not land well. So,
Mm.
bringing it up sort of in a subtle way, depending on the person and your relationship, you could say like, "Hey, how are you having like some insecurities about your body? Like, I see you doing these things, or are you feeling like a little stressed lately about the food? Like, how's your appetite been? I know that, you've had a lot going on. Like, validate that they've had a lot going on, that, that they've been really busy, or, whatever they're going through. I feel like all of us have a lot going on. So, validate the stressor, and then with concern and gentleness and empathy be like, I've noticed some of these things and I just really want to make sure you're okay. um Maybe you can be like, hey, we're all going to start seeing a therapist individually just for fun, like New Year's resolution, and then hopefully maybe they'll open up to a professional, and then you can determine from there what level of care is appropriate for them. Hopefully they can start seeing a dietitian, so you could sneak it in that way if you feel like they won't open up to you.
Yeah,
But definitely not being like accusatory, right?
yeah.
And sort of opening up the conversation in like a from a point of concern, and just see what they say. Like, yeah, I have been feeling like, if I don't exercise, like I'm gonna gain a bunch of weight, or this is gonna happen, and that's gonna happen, or I just feel so uncomfortable when I have food in my stomach. Like, maybe they will open up.
Hmm.
And maybe they don't even recognize the extent that this is, or even recognize
Right.
that they have an eating disorder.
Right. I mean, how
So,
many people come to our offices and they aren't sure what's exactly going on for them, right? Maybe they recognize, yeah, I'm not feeling as happy as I was. Yes, I'm thinking about food a lot, but they're not even clear, right? So if we're asking the loved one to have the conversation, to have the person open up, that person struggling might not even have the words yet. So I
right.
like what you said, Hannah, about coming from, you didn't exactly say this word, but this is what I was hearing in your speaking, is like coming from concern and also coming from curiosity,
Mm-hmm.
right? Because these eating disorders, they don't really come totally out of the blue,
Yeah.
right? Sometimes I have people like once they start getting like, oh, yeah, I have been struggling with my food and my body, and they can name sort of when they think it started. Oftentimes, it even started sooner.
Right.
And it may not have been the more acute behaviors, but the thoughts and the thoughts about themselves or their bodies started longer before some of the behaviors started. And I think you also said this idea about like joining with them,
Hmm.
right? Not like you have this problem, but like, okay, I care about you. How can we work on this together if there is that openness, right? And like oftentimes it takes more than one conversation, right?
Yeah. Yeah. And it might even be like, I've noticed that you're not really wanting to eat like the pasta or like the bread on your sandwich. You sort of been picking like, is there a reason why like you're sort of avoiding carbs? Like, did someone say something? Did you hear something online? Validating that maybe they heard it from somewhere and then they can open up. And coming from a place, like you said, of curiosity and how can I support you? I know there's a lot of stress going on, a lot of changes have happened lately. Like maybe it might make you feel better if you could talk to someone about it. Like, is it okay if I find you a therapist?
Hmm.
Because then from there, maybe as they share in therapy, the therapist can say, well, it sounds like that this is going on, instead of like, I'm gonna get you, a shrink for that food problem you got going on. Like from a place like that where, because a lot of times the root is significant stress, some sort of life change, even if it's a positive change. Change is stressful.
Mhm.
It could have been a traumatic event that happened. Even
Mhm.
COVID, the lockdown
Mm.
sparked a
Wow.
lot of eating disorders out of nowhere
Absolutely.
because it was a lot, for the world, right? To be on lockdown.
So, just to recap, we're saying trust your gut,
Mm.
pay attention to the signs, like eyes wide open, look at what the patterns and the changes have been, and have the courage to have maybe what could be for some people, they might feel relieved their loved one is coming to them, that
Mhm.
somebody's actually paying attention to what is going on. It might be more than one conversation. And now, Hannah, what you're moving us to is how do you start getting that person help? And one place is to start with a therapist who really specializes in eating disorders.
Right.
Another great place to start is the medical doctor
Yeah.
off, but the medical doctor could be another really great place, especially if they have some kind of relationship with their medical doctor, right? Because the medical doctor can also begin to really look at what have been possibly the bodily changes and have some of those honest conversations with that person.
Yeah, yeah, and it's definitely a significant plus if the providers that this person is being seen by are familiar with eating disorders, because there's some, if you're not trained in it, then it's really easy to kind of say the wrong thing, to put
Oh,
it,
yes.
yeah, to put it that way. So really making sure that they are sensitive, at least sensitive to that topic if they're not specialists, sensitive and aware about that topic so that they can refer out to the specialist if needed, and validate that there's an issue there.
And the other thing I always tell people is I'm a resource, like we're a resource for people, not just through FAB, right? Like sometimes people come to me and I know that they're coming to me to help me get them to their next step.
Yeah.
Maybe they're calling from a different area or they're trying to find a provider, on their insurance or whatever it might be. And then sometimes those people end up working with us in FAB, but we truly are a resource. If you have questions, if you're wanting to know how to approach a conversation with your loved one. And what I would say is have the courage to have those conversations, because usually it's the loved ones that connect the person to the help.
Mhm.
That's mostly in all the years I've been doing this, it's not always the person struggling who's accessing the care for themselves. It's the loved ones.
Yeah.
So, Hannah, I think that's it for right now. We will definitely see you next month when you join us for Why Eat Carbohydrates or whatever we end up choosing. But that's an important one. But thank you so much for being here today.
Thank you for having me.